welcome back, everybody, and thank you for listening in to the Fourth Wave in Therapy. It's my absolute pleasure today to have with me not only a colleague, but a fellow co-author, and I'll tell you about that in a little moment. But with me today is Celina Tonkin. Now, Selena is based in the beautiful Victoria here in Queensland, in Australia. What am I saying? It's because I feel you're so close to me, Selena, that's why. Selena is a powerful coach. She combines many years worth of training, hypnotherapy, neuro-linguistic programming, and EFT, of course. She really is passionate about working with women in particular and has a fantastic program that really extends my research work in EFT and food cravings and adds to that some other elements. So it is called The Missing Link. And we have all the details below so that you can go off and connect with Selena if you do want to learn a little bit more. And of course, together a couple of years ago now, we co-authored the book EFT for Introverts. And that is purely because the pair of us are introverts and we really talk about such a great book, and I'll make sure the link is below. How can introverts use the power of EFT tapping to help regulate their nervous system, cope with unique situations that introverts, really do face? And we really talk a lot about our own personal experience in that book. So links below. But what we're really going to unpack today, which I was really keen to talk to Selena further about, was a recent health experience that she has been going through, but one that she has used EFT to support her healing journey. So Selena, thank you so much for joining me today and for wanting to share quite a personal story here.
Yeah, well, for that introduction, Peta, and thanks for having me at the podcast. I'm so grateful that I can share this, personal journey, and as a fellow introvert,
100%.
I would like to keep this story private. Yeah, it's a private journey. However, because I used EFT and I found it so extremely helpful, I want to share it with people who are listening and EFT practitioners who are dealing with clients or might be dealing with their health issues. The power of using tapping with very serious health conditions. And I know in my case, and in my case of some of my clients, that EFT transform potentially post-traumatic stress disorder experience into post-traumatic growth. And that's why I'm so excited about sharing about it. Yeah.
Let's get into it then, and maybe you can tell us a little bit more for anyone that just isn't from the medical field. So you were diagnosed with a desmoid tumor.
Mm-hmm.
Can you explain to us what exactly is that? When did you find out? And obviously, what was your initial reaction to that kind of diagnosis?
Yeah, sure. So I imagine it's 2021, December, I'm in Melbourne, middle of COVID, the highest restrictions of movement in the world.
Yeah.
And I woke up one morning and I have excruciating pain in my ear and the left side of my neck. It's very hard to find doctors, but that doctor that I got in touch with, after some tests, she diagnosed muscle knot. And she sent me to a good physiotherapist to treat me for muscle knot. So I had many sessions, and instead of the pain going down, it actually kept increasing. So I said to him a couple of times, look, is it possible that there's a lump there? And he was like, nah, I don't think so. And then one day, now it's like April 2022, I said, I can't stand the pain anymore. I really need to investigate more. And I go for an ultrasound, and the radiologist comes out of the room and he goes, Selena, have you injured your neck? And I'm like, no, not really. And he looks very puzzled. The results of the ultrasound come out, and the same day I end up admitted in the hospital. So now it's April, Easter, middle of COVID, but because it's Easter, even less doctors. But I'm in hospital. We do PET scans, we do MRIs, we do biopsies, like really some painful procedures, blood tests, and the doctors come in and out. And I have some videos of my that I have taken after the conversations with my doctors. And you can see my face, like being perplexed, being scared, being hopeful, being confused, because they were coming in and out saying, it's cancer. It's not cancer. It's this. You need surgery. No, it's not that. You don't need surgery. That's how it was. And then after 7 days in hospital, I was finally diagnosed with a very rare condition called Desmoid tumor, which is basically intermediate cancer. So it's intermediate because it doesn't spread through the body, but it can create havoc in the area where it shows up. The type that I had often shows up after physical injury. So now, Peter, imagine I have this huge 7x6 lump, 7x6 centimeters lump in the neck.
Wow.
You can see how slender my neck is. You couldn't see it from outside. It was all internal. So this huge thing is now pressing on my muscles and my nerves, hence the excruciating pain. But at least I know now I have a name. So it's like a starting point for me now. Yeah. And by this time, of course, I have all sorts of emotions. I have fear. I have anxiety. I feel like my body betrayed me. Because just a few months before that, my niece said to me, Auntie, you're so healthy, like you're never sick. So my identity is this identity of a healthy person, and suddenly I'm having something deadly. And so lots of feelings. And one of the feelings was anger. Yeah. I can tell you.
Yeah. Is that where, and I don't know whether in the time of all of this span you were using EFT tapping, but was anger is such a present emotion, even about, well, you were, in terms of Australia, the hardest lockdown during that time was the state that you were living in. We had a lot more freedom where we are. Like, was the anger the thing that you targeted with EFT, or did you want to let yourself feel the anger? What was happening?
Well, it's a really great question because I also assisted with the EFT and pain trial that you conducted at Mount University. So when I started feeling this anger, I thought, I wonder what is this about? Because we know anger from the trial and what you taught us, anger has a protective function. Yeah. Anger releases neurotransmitter that numbs your pain. So short term is good, but in long term, it increases the inflammation of the body. So this is one of the advantages of being an EFT practitioner and having that knowledge. So the anger was with the physiotherapist, not because of what he did, because it was a very confusing issue. Even many oncologists haven't heard of desmoid tumor. It wasn't because of what he did. It was because he wasn't listening. And he was dismissive when I said to him a few times, like, this is excruciating pain, and he wasn't listening. And that's, and in fact, what he did, it was absolute normal for desmoid tumor, but he didn't know. But not being listened and being dismissed was very triggering. But knowing the function of anger, I could ask myself, and this is what I teach my clients, I could ask myself, am I going to do something about this? Or am I just getting angry because it numbs the pain? And so I would tap on it. And the answer was usually no, I'm just getting angry. I'm not going to do anything about this. So I let go of anger. Yeah.
And tell me, medically, did you have to go through treatment from this point forward? So after 7 days in hospital and finally come to some conclusion, obviously they find this thing's quite big. Did you have to go through medical intervention for that?
Yes. So imagine now I'm in Peta, the biggest cancer hospital, really state-of-the-art hospital. I'm sitting here with 2 oncologists, and they're saying, Selena, we reviewed your case, and because such a rare case, like the board of doctors reviewed your case, and we are concerned about your life. The lump is 2 millimeters from your neck, and we advise that you go on chemo immediately.
Okay.
And so because by now I have been tapping daily, and I have been tapping a lot on fingers. So it's so good because you can tap anytime, anywhere, under any circumstances. And even though I had this on surface, I had lots of turmoil and anxiety and fear. Underneath all of that, I was grounded. Because the tapping helped me to keep that cortisol level at a manageable level, So my brain was calm. So when they said your life is in danger, the first thought that came to my mind was, you are great technicians, but it's actually my life is in the hands of the higher power.
Yeah.
And I trust that. And then, So basically, after investigating and going to, seeking second opinion, I decided to go ahead and have the chemo treatment, because at that stage there was nothing else for desmoid tumor, because it's not cancer. So even chemo, it's not for desmoid tumor, but there was nothing else. So I said yes.
And tell me, was their intention to try to impact the size of it so that it became smaller, and that's what the chemotherapy was about as far as treatment?
That's right. That was the hope, that if it works, it will stop the growth and basically save my life. Or in best case scenario, decrease the size of the tumor. Yeah.
And tell me, a lot of people, when they think of chemotherapy for, cancer treatment, worry about the side effects of chemotherapy. Did you experience any of that? Was tapping part of your coping during that time?
Totally, all the time. So I did ask the oncologist. I said what the side effects I can expect, and the chemo is called Red Devil. It's the harshest chemo in the world. That's right. So I know. So, but remember, I'm tapping. My brain is staying calm. And like they said, God doesn't give you more than you can handle. I've got tapping, And so they said, you will lose your hair. And then they sent me to, like, everyone gets education before chemo. So the nurse said to me, you most probably will react because it's a very strong chemo. But don't worry. We know, like, you'll hear bells, you see doctors running around. Just we know what we are doing, okay? So I made a tapping script for myself about chemo, which I used every night to program my brain. So here I am, first a day in the chemo room, and I'm watching the Red Devil getting out of the plastic bag and going down the tube and entering my vein. And now we are waiting. I'm tapping, and 1 minute goes by, nothing happens. 2 minutes, 3 minutes, 15 minutes. The nurse says, you can relax. You are the critical period has passed, and I'm like, yay! So I made videos immediately for my family, for my little friends support group, and for the oncologists in Israel. And I said, I'm over the crisis period. I'm fine. And I sent him the video, and the answer comes in the WhatsApp, and he goes, if you can deal with chemo this way, you can deal with anything in life.
Oh, wow. The Red Devil. So does that mean you didn't necessarily feel the nausea, or like what happened with your hair? Like, how do you think tapping was helping you?
Well, this is how I think it was helping me, because it was helping to keep the body relaxed and muscles relaxed. So I wasn't adding extra pain or stress to my body. So when I was in the chemo room, my body could function at an optimum level, rather than being stressed and scared. Of course, there was some of it, yeah, but it was generally relaxed and wasn't fighting. So basically what happened, the hair got thicker.
Are you serious?
I'm serious, I went to a hairdresser, my usual hairdresser, after chemo, and she goes, your hair is thicker. My hair got blonder.
Oh my goodness. It didn't fall out. You didn't go bald.
Look at this. That's,
Oh,
yeah,
that's your original hair all the way through chemo.
all through chemo. And uh, also what I did was I made a decision never to walk out of the hospital in tracksuit pants and looking baggy. After every chemo session, I would dress up, and my poor husband had to take a photo of me looking glamorous next to
Coming off the chemo.
the chemo.
Wow.
So I did, at one stage, I did get blisters on my left foot for 3 weeks. And that gave me an indication how it could have been,
Okay.
if I didn't actually take all these protective, healthy measures. And also dealt with the sleep, because I had, constant lack of sleep. I can tell you one thing, Peter, you can survive without sleep.
Okay.
You can. It's hard, but you can. Yeah. So what I used to do is I would instruct my body, imaginary tapping. You don't have to move your hands if they hurt or you're tired at night. And I would do imaginary tapping, and I would instruct my body once again to relax and not to force myself into sleeping. To accept this is how it is right now. So that meant, even though I didn't sleep, my body did get some rest through the night.
Yes, yeah, like a deep sort of rest rather than
That's
the
right.
sleep. Yeah.
Right. Yeah.
And you mentioned the script that you wrote yourself for when the Red Devil was coming into your body. What were the words? What were you saying to yourself in the tapping, whether you were doing finger tapping or as that Red Devil was flowing into your veins?
So one of the things that I always said to myself is that no matter what's happening in my body, I'm whole and complete. Okay.
Whole and complete. Yeah.
That was one of the things that I used to say. One of the things, so acknowledge. We know with our tapping, with the setup statement, you acknowledge, yes, I am getting chemo. And then you accept, right now, just for today, I'm getting chemo, but I'm curious about it. Yes, the word is triggering, but I choose to be curious about it.
Yeah.
Yes, I don't like it, but I can relax the muscles. Yes, I can trust my body that it will direct the chemo where it needs to go. And it is a healing medicine.
Yeah.
So those are some of the words that I choose to create. Now, when I, talk with a client, I will listen to what resonates with them, because these words might not resonate with them. Yeah. But the principle is acknowledge. I'm getting it, whether I like it or not. So I'm getting it. Accept it right now, just for today. I'm accepting it, and then work with that as much as you can. So the important thing for me, what I discovered while doing all this tapping and a bit of experimenting, is work with what you have control over. So I didn't have control over the lump, but I had control over the muscles of my body. So I would say, just relax in your chair. The chemo will go through and will go out.
Yeah.
So those are some of the things that, I did. I tapped on.
Amazing. Tell me, how long did your treatment last? How long were you obviously having chemotherapy? And obviously we're now, just to date stamp us, 2025. So we're a couple of years out of going through what you did.
Yeah.
And tell the listeners, where are you at now?
Yes. So the chemo, let me just tell you, after the last session of chemo, 8 days after the last session of chemo, I packed up my bags and went around Australia for 30 days by myself because I just needed to get out of Melbourne and have some freedom, get out of this, atmosphere, like the whole situation. So the chemo worked for a certain period of time, but then it stopped working.
Okay.
And well, can I just tell you something? Can I just just create a bit of I'm fine. Now I'm fine, okay? But one of the things that I learned from going through this journey is the importance of, we know to tap, to look at what happened 18 months before, okay? One of the questions that we did in the trial often was ask people what happened, was there before the first symptom, or was there divorce, was there something else? Well, in my life, my mom passed away, my dog had huge surgery, then passed away, my father-in-law passed away, and then my brother passed away, and my mother-in-law passed away.
Wow. So that was all the preceding events.
The preceding events, my mother passed away, my dog had huge surgery, and my father.
Yeah, wow. Okay.
Subsequently after that, my mother-in-law passed away, my dog passed away, and my brother passed away.
Yeah.
But the story is a bit dramatic, but why I'm sharing this is that we can deal with anything, and life is life. Life will give you things and challenges, and it's how you respond to it. So, the tapping, as I said, was essential of how I responded with all of those events. But one of the things that I learned was the importance of dealing with adverse traumatic childhood events. If you are dealing with something as drastic as cancer, autoimmune disease, or diabetes, or things like that, it doesn't mean that there's always correlation, but often there is between what happened in your childhood and the diseases you get later in life. So I resisted for a long time to tap on those events because I tapped on those events a lot in the past. And but then chemo stopped working, and there was nothing else that I could use. I stayed calm, trusted, and then one day I woke up and I remember the words of the radiologist when he came into the room, and he said to me, "Selena, have you injured your neck?" And another name for desmoid tumor is scar tissue. And for some reason, as soon as I remember scar tissue, all the events from my childhood flooded back. It was fascinating, clear events from the childhood that I thought that I worked through them. And so basically, to give you a context, my mother and both my mother and my father were war veterans. They were at the front line. They were war veterans in the civil war in Greece. They saw things that they should not have seen. They suffered from severe post-traumatic stress disorder. My father became violent alcoholic. He was in prison for domestic violence. So my family life resembled World War III. And that programming was to program me to basically end up in prison or suicidal, something like that. But I worked really hard through those issues, and I created a great life. However, that morning, when I remember the words of the radiologist, I remembered events from the childhood when I would lie in bed totally tense and hypervigilant because my father was going around the house, and in anticipation of violence, I would tense. Now, when your life is in danger, or you think your life is in danger, what do you tense most? It's the neck.
I was about to say, yes, it seems like that would be the space.
Most vulnerable part. So you want to protect it. So that's where the wear and tear of the neck started. That was the first injury.
Wow. And I'm guessing that's where you're tapping then, that you were tapping on those memories from childhood, and a lot about, obviously, how to apply tapping in those therapeutic settings. So you would have been working through those memories. Is that right?
Exactly. I went tapped with a practitioner, I tapped by myself, and like I released all that stored trauma on that cellular level, and I started feeling this shift in my body. And this is the interesting thing. Sometimes, not always, but sometimes when you transform to that level inside, something will happen outside in the universe. And it's like the universe will reorganize itself. Something will happen. So while I was still tapping on these childhood events, I received a message from the oncologist. And she said, Selena, do you remember you were asking about such and such drug? Well, the American Association of Food and Drug had approved the drug.
Oh, wow.
The first ever drug for desmoid tumor. First time ever. And we applied, we got it. I took the drug, I continued tapping, and then lump has almost gone. I can actually see my neck. Am I right?
There you go. So we're now a couple of years down the track.
Yeah.
You've got access to that medication, still kept tapping, but obviously it's been able to work positively and well, and now you're almost kind of without the desmoid tumor scar tissue and
Right.
living life.
Living like I can actually turn my neck
Oh,
with
wow. No pain.
no pain. And
Mm.
yeah. So I retain the flexibility in the neck. So keep an open mind.
Yeah.
No matter what you're dealing with, if you can find a way to stay calm. For me, it was tapping. I hope it's tapping for not personally you, but I know you love tapping.
Yeah.
I hope it's tapping for you to keep staying calm, no matter what the situation, because the answer might come, and will come eventually. Yeah.
And it sounds like in such a moment of despair, any kind of cancer diagnosis, can obviously result in shock and disbelief and even kind of denial for a lot of people. And
Yeah.
obviously, then, traditional medical treatment. So you're absolutely right. You did mention it was the medicine that was going to be part of the healing process. But it sounds like tapping allowed you to stay calm in the face of all of that, keep the body in a calm physiological state as well, like, cortisol and inflammation and things like that, because we've got all the studies that show that's the outcome. And that, it's made a really powerful difference by the sounds of it.
Well, it did, because no matter what was going on the surface, and I'm telling you, it wasn't easy. It wasn't like I was happy, chappy. No, but I had this sense of being grounded.
Mm.
And with that, the sense of hope, and an answer will come. And the sense of acceptance, just for today, this is how it is. And then we'll see what tomorrow will bring. But when you can keep your body calm to that extent, then the energy, I use the energy to continue walking. I walked every day more than 10,000 steps a day, like I always did. Every morning, Peter, before chemo, on the day of chemo, the day after, I went for my coffee, like I always did. So that is the power of the tapping. I didn't disperse the energy. It didn't turn into stressful energy. It didn't cloud my mind. We know when we are stressed, the blood drains from the brain. You can't you feel stupid because you're stupid. There's no blood to, think. But when you tap and and you keep that cortisol level at manageable level, you can make more clear decisions that are serving you. So that's what happened. Inside of that, I could make fairly good decisions for my life.
Yeah. Selena, what a powerful story. And, often people would never look back and want to go through it all again just to learn the lessons that might have emerged out of it. But what a gift perhaps tapping was through that whole journey, even though it was during lockdown, and even the ability to kind of go back and be able to work through some of the childhood stuff that maybe still was having an impact there, at that physiological level. And we know there's such fabulous books out there about, The Body Keeps the Score by Bessel van der Kolk, or, When the Body Says No, and things like that, yeah, truly, all of this stress can be physically within us, and tapping being, such a wonderful tool that you already had in your life that you were able to use during this whole journey.
It did. And by the way, I have those 3 books. I have your book, The Body Keeps the Score.
Oh, there you go.
Yes, no, the,
Jeff.
your book is, yeah.
How wonderful. That was purely just my guess.
It's so funny. Well, there's the other one.
Yeah, Bessel's book.
Yeah.
Just, he was ahead of his time, really indicating how much stress and trauma is stored in the body and then waits for the right moment, perhaps, to resurface.
And, then, as I said, it was very interesting, that I assisted at the trial, the pain trial. So
Yeah.
I had really clarity also which questions to ask, what to look for, to let go of that resistance to look at the childhood events again, because I worked so hard in the past, and all that was very helpful. Yes. And thank you, Peter. Like with all the research you do, for an introverted mind like me, I'm skeptical and I need the research as well. So,
happy to help.
we can go on your website, and I have told with the pain doctors at the cancer hospital, and told them what helps me, and I refer everyone to your website.
Amazing.
Yes, it's
Thank
good.
you so much, Selena. And look, thank you for sharing, this story. There might be someone listening in who, hasn't explored tapping, or might be going through some sort of health crisis themselves, and maybe might go off and, explore a little bit more just about how you can keep the body calm through some of these, definitely fourth wave, but somatic body processes, just to help whatever else you have to go through from a medical treatment point of view, for mind and body. So thank you so much for sharing this story today.
Yeah, absolute pleasure. And yeah, let's hope it helps someone. If it helps one person, I'll be very happy. Thank you, Peter. Thanks for
Thank you, Selena. And I absolutely hope there's another book that perhaps you'll put this in writing one day and share this story. There you go. There's my challenge.
anything is possible.
I love it. I love it. Thanks so much, Selena. And hope you listen in again to another episode, everyone. And we'll see you again in the fourth wave of therapy.
Beautiful. Bye for now.